with Traumatic Stress by Dr. Glenn Mesman. My name is Riley Thomas, and I work for the Arkansas Building Effective Services for Trauma program, or ARBEST. ARBEST is a state-funded program at the UAMS Psychiatric Research Institute, which aims to improve outcomes for traumatized children and families through excellence in clinical care, training, advocacy, and evaluation. We're probably most well known for the free trainings that we host throughout the state. Here to talk about high-risk behaviors in adolescents with traumatic stress is Dr. Glenn Mesman. Dr. Mesman is a licensed psychologist and associate professor in the Department of Psychiatry. He provides evidence-based mental health treatment for children and adolescents with specializations in early childhood mental health and trauma. He is certified to provide trauma-focused cognitive behavior therapy and child-parent psychotherapy, and he is a trainer in child-parent interaction therapy. Dr. Mesman is also the assistant training director of the psychology doctoral internship and postdoctoral fellowship programs within the department. Additionally, he is actively involved in ARBEST, a program sponsored by the state legislature to improve outcomes of traumatized children throughout the state of Arkansas. Now for some quick housekeeping. If you have questions during the webinar, at the bottom of your screen, there's a little Q&A. You'll put your questions there, and at the end, we'll save time for as many questions as we can. If you're interested in earning a CEU, stick around till the end for instructions on how to obtain that. We're recording this webinar, and we'll put it up on the ARBEST YouTube page. So if you need to step out for a minute or want to share it with a colleague, it will be available. All right, that is all I have. So I'll turn it over to you, Dr. Mesman.
Thank you, Riley. Okay, I'm going to screen share our slides here. Okay, you should just be seeing the slides, right, Riley?
That's right.
Perfect. Okay. Well, it's nice to, as I see everyone again, but I don't see everyone, but I know a bunch of you are there. I've done some webinars in the past, and I was excited to be able to come back. It's been a little bit, though. So this presentation is really going to be focusing on high-risk behaviors in adolescents who've experienced trauma. It's not going to be really focused on the treatment of these high-risk behaviors, but these are the outcomes of trauma in this age range. And for all those who are working with adolescents, it's important to be aware of these outcomes because these may be issues that come up in the treatment that you are providing as well. Okay, so let's look at our objectives today. What am I hoping that you'll be able to accomplish, be able to do by the end of the presentation? One, hopefully by the end, you're going to be able to define trauma and describe different types of trauma that does occur. Also explore different pathways of adolescent development. So we're going to be talking about what is typical adolescent development, and then how does trauma disrupt that pathway, and then what are the signs and symptoms and risk and red flags that you're kind of seeing in that domain. So once again, we're going to explore the pathways and how trauma disrupts them, and then really thinking about like what are these high-risk behaviors that are happening because of trauma as well. We're going to be talking more about like delinquency, substance use, and some others of these kind of illicit behaviors that occur. And once again, things to be really mindful of, aware of when you're working with this population. So first, we're going to talk about the top objective. So defining trauma and describing the different types of trauma that occur in this age range. So child traumatic stress really refers to the physical and emotional responses in youth to events that happen that threaten their life or physical integrity to them, or someone that's critically important to them. So really, these are scary, kind of unpredictable events that happen to children or adolescents. And there's different ways that people can be experiencing traumatic events. You can directly experience it, such as maybe the case someone has a motor vehicle accident. You can witness it, maybe in the incident of community violence. And also there can be indirect exposure, such as hearing about the violent death of a loved one. But these traumatic events, so we have a potentially traumatic event. So is there something scary or dangerous that's happened to the child? But then does it lead to feelings of overwhelming their ability to cope or manage the feelings that are happening? Because this often can lead to feelings of terror, feeling powerless, or kind of out of control physiological responses that happen. So these can be intrusive thoughts or reminders or memories that just pop into someone's head about the traumatic event. Maybe they're avoiding things that remind them of the trauma, changes in mood or thinking, and also changes in their body. We have this increased arousal, such as maybe hypervigilance or exaggerated startle response or angry or irritable behavior. But the main thing with trauma is there has to be a potentially traumatic event. And then also there has to be corresponding changes with mood or behavior or thinking that overwhelm someone's ability to cope with the potentially traumatic event. Okay, so we have different types of trauma. One type of trauma is an acute trauma. This is a single incident trauma that is limited in time, such as maybe a motor vehicle accident, or maybe someone has witnessed community violence. Maybe there was a drive-by shooting or a natural disaster. So here in Little Rock back in March, there was a tornado that came through Little Rock. So that would be an acute trauma because it was a single incident trauma. There could be the sudden or violent loss of a loved one, such as a caregiver who has passed away, or maybe it's a grandparent a child was really close to. And then maybe a one-time physical or sexual assault. Though we know that often physical and sexual assaults can occur more than one time, but an acute trauma would be if this was someone who was shot at one time, or there was a sexual assault that occurred one time. So acute trauma is a single incident trauma. It's limited in time, and it's kind of happening just one time. This is different than chronic trauma. This refers to the experience of multiple traumatic events. So this can be multiple and varied traumatic events, such as a child maybe who's exposed to domestic violence, and then maybe there was a car accident, and then there's community violence. So these are different types of trauma that has occurred over a longer period of time. But also, there can be the same type of trauma that is occurring over a period of time as well, such as maltreatment, like physical abuse or neglect, or being in a place where there's an active war situation. So we can have different types of traumatic events or the same type of traumatic event, but it's repeated over a period of time. And the issue with chronic trauma compared to acute trauma is that with chronic trauma, each subsequent traumatic event reminds the child of the previous trauma and also reinforces its negative impact. So we have acute trauma, chronic trauma, and then we have complex trauma. Complex trauma describes both the exposure of chronic trauma. So by nature and definition, complex trauma is chronic, but also it describes the wide-ranging impact that it has on the child in a variety of facets in life. So we know that, and often complex trauma involves the early caregiving parent-child relationship. So this is chronic trauma that's interpersonal in nature and beginning in early childhood, but it can impact relationships and attachment, impacts one's body, also bodily rhythms, impacts biology, and it can impact someone's emotional state, affect regulation, also behavior regulation. There can be dissociation or depersonalization, derealization. It can impair someone's cognitive skills, so their thinking, their planning, their language. They can have lower educational attainment or intellectual functioning on scores of IQ tests, and also impacts self-concept, so lower self-esteem, and also shame or guilt, and also self-efficacy as well. So their ability to belief in themselves and their ability to accomplish difficult or challenging tasks. So we have acute trauma, chronic trauma, and complex trauma. But why is it important that we're talking about trauma during adolescence? So this study looked at exposure to violence from birth to age 17, and this was 4,000 youth, and this happened about a decade ago. So with early childhood and childhood, they interviewed the caregiver, but with adolescent years, this was self-report. And this is based in their lifetime. 51% of children and adolescents in this study reported some type of physical assault. 8% there is some type of sexual assault. 24% reported some type of maltreatment, whether this is neglect, physical, sexual, or emotional abuse, and 38% witnessed some type of violence, whether this was community violence or domestic violence. And once again, this is for children and adolescents as a whole, but you can see it is not uncommon for youth to be experiencing some type of potentially traumatic event. Once again, this doesn't necessarily mean that these kids had full-blown like PTSD and needed trauma treatment. This is just the exposure to the traumatic event. Going in a little bit more in depth with just adolescents, this was a survey, this was a telephone-based survey that was actually a few decades ago, so this is a little bit older, but this looked just at adolescents and what they were reporting in their lifetime. 17% reported some type of physical assault, 9% there was physically abusive behavior that was occurring in the home setting, 8% with reporting sexual assault, almost 40% saying they've witnessed some type of violence, a quarter were in some type of natural disaster, and a fifth, so around 20%, 21% reported being in a serious accident. So once again, this is not uncommon for adolescents reporting that there has been a potentially traumatic event. So this was actually, like I said, an older study way back in the 90s. So they replicated this study in the 2000s as well. And they found actually pretty similar results. And this was a telephone-based survey of adolescents across the United States. So once again, 8% reported sexual assault, which is very similar to the previous study. 38% witnessed community violence, 9% reporting domestic violence, and 18% said they've had experienced the death of a family member or a friend to homicide. So 1 out of every 5 almost said that there was some type of death due to homicide. And this was done in the 2000s. And then the Great Smoky Mountain study looked at youth. They surveyed them longitudinally ages 9, 11, 13, and then annually 14, 15 until they were 16. And they looked to see what percent of the youth reported experiencing a potentially traumatic event by the age of 16. And you can see here 68% reported having a potentially traumatic event. The most common ones were death of a loved one, sexual abuse, a serious illness, a serious accident, and then experiencing a natural disaster as well. So once again, I hope I've impressed upon you the importance of being thoughtful of when you're working with adolescents. A large subset of the population has been exposed to a potentially traumatic event. But we know that potentially traumatic events do not necessarily occur the same across everyone. We know there are subsets of the population who have an increased risk of traumatic events as well. This is for children of color have a higher rate of potentially traumatic events, females compared to males, those that have some type of intellectual or developmental disability, and also the LGBTQIA population as well. So it is important to be mindful. Yes, there is a huge risk for youth, but there are some populations that have even a higher risk. But the reasons that these traumatic events are so important to be aware of, because it can really impact adolescence development. So when a youth incurs multiple traumatic events over a period of time, so this is more kind of chronic or complex trauma, they're especially likely to have multiple gaps in their development, particularly if the trauma occurred at a younger age. It really challenges a youth's ability to complete subsequent developmental tasks. It's like you're trying to look at the picture. Like you're trying to climb a set of stairs where there's all these missing steps. So in adolescence, the traumatic events and the secondary adversities that are associated with the trauma, and also frequent disruptions in living situations that can occur because of the trauma, really impair an adolescent's ability to be prepared to be a productive, functioning, contributing member of society when they reach adulthood. Because you think about adolescents, like they're getting ready for adulthood, they're ready to be doing all these different things, but because of the trauma, they may feel woefully unprepared to do those things because they have all these gaps and they're missing in their development. So these are the areas that we're going to be talking about. These are really important areas of development in the adolescent years. And then once again, we're going to go into each one and talk about how has trauma potentially disrupted that development. So we're going to be talking about comfort with physical body and hormone changes. That definitely happens a lot during adolescence. Peer-related social skills, the ability to modify and control emotions and behavior to meet their long-term goals, abstract thinking, and also independent self and identity. So we're going to be talking once again how trauma impacts all of these things, and also what do we expect with these developmental milestones as well. So first, let's talk about physical development. So I remember back to my adolescent years, Wow, there are a lot of physical changes that happened in my body, and not always things that I was always well prepared for, and being and just always being able to manage. So there's rapid and profound changes, especially in early adolescence. This is the onset of puberty. There's a growth spurt. There's an increase in your height and your weight. Hormones are raging a lot more. You have the development of primary and secondary sex characteristics as well. You're looking less like a child and more like an adult who's physically and sexually mature. Whether you're cognitively ready for that, that's a little different, but physically, that's what your body is changing. And these effects of these rapid changes really leads to an increased focus on your body. Do you physically look like the rest of your peers? As a male, have your shoulders broadened? Has your voice deepened a little bit? Are you developing facial hair? And you're comparing yourself to your peers. And if you're not changing at the same rate as your peers, there can be a lots of kind of self-doubt on what you look like. Are you masculine enough? And I know all these things happens for females as well. But because of these rapid changes, there's just such a focus on your body during these years. So there's such a focus already, but now because of trauma, that can lead to really a lot of discomfort with somebody's body. So sometimes bodily development can be not only uncomfortable, but actually distressing. Imagine a girl who is sexually abused as a child. Now, as she is developing secondary sex characteristics, such as larger breasts, she maybe feel like she's attracting unwanted attention. And also, bodies can serve as a trauma reminder. Maybe someone has scars from physical experience, abuse they experienced when they were younger. And whenever they see that scar, it actually reminds them of the trauma. Sometimes adolescents, all of you who works with adolescents, I'm sure are well aware of self-injurious, non-suicidal self-injurious behaviors that can occur, such as cutting, piercing, tattooing, even maladaptive eating can all be seen as coping strategies to trauma. Also alcohol and substance abuse. It's a way to try to control really strong emotions and out of control physical sensations. And also alterations in the immune system. Because of trauma, particularly if it's more chronic, often there's the alterations in the stress response. There's an increase of cortisol in the system. So because of that, it can really impact the immune system. So they're just more prone to being sick or ill. Variety of somatic complaints, headaches, stomach aches, nausea, all of those things can happen because of chronic trauma. And they've actually done research with youth who've experienced trauma. Their stress hormones are similar to combat veterans. Because of the trauma they experienced, it's just impacted their stress response system so much. And these alterations of the hormone have not only short-term implications, but also long-term implications. It puts them at a huge risk for a variety of health-related consequences as an adult. So because of this chronic trauma, they have an increased risk for cancer, type 2 diabetes and obesity, also a variety of negative health behaviors such as increased alcohol consumption, binge drinking, illicit substance use, and also smoking as well, and decrease like physical activity. So once again, we can see trauma is impacting the physical development in adolescence. Okay, social development. Oh my gosh, thinking back to my adolescent years, I was like not trying to do nearly as much with my parents or my family. I was like, oh my gosh, they don't understand. They don't get it. My friends, they get me. I need to spend time with my friends and my peers. If you remember back to your adolescence, those may be similar feelings to what you had as well. But it's all about friends and peer and social activities. Try to be out of the house as much as possible. Friendships and peer relationships become so important in adolescence. It's really when we see peer interactions at their peak in the child and adolescent years. And if an adolescent is able to make friends and belong to a group, it really protects them and makes it more likely they're going to be successful in probably other areas of development as well. Because friends, they provide emotional support. They listen, they support you, they encourage you, they help you, and they can really buffer from the negative impacts of teasing or bullying that occurs as well. Okay, adolescent years. Who remembers having their first crush? Someone that they were interested in. They wanted to go on their first date. And maybe that's when your first dates were, the first kiss that you had. Oh my gosh, all the awkwardness that happens in the adolescent years with romantic interests, but this is becoming much more common during these years as well. Are you dating someone? Are you in a relationship? I don't even think the phrase going steady is a phrase that people use anymore. I don't know. It's been a little bit since I've worked with a teen. I got to get a little more up to date on the lingo of what do we hanging out? Is that what they call it nowadays? I don't know, but if you ask someone if they're dating someone, like they don't even know what that really means. So I gotta brush up my lingo a little bit with these adolescents and what they're up to. But you know, these romantic interests in dating once again start to become much more important in the adolescent years as well. But we know trauma really can impact social development as well. Can lead to feelings of isolation and withdrawal. Sometimes adolescents may feel weak, maybe strange or even childish because of these out of control physiological responses that they have. And also because they're feeling more isolated, it may put them at an increased risk for feeling anxiety, whether this is social anxiety or more generalized anxiety. Isolation can also lead to feelings of depression and also just withdrawal and just feeling that they don't fit in. Also, there can be this persistent distrust and suspiciousness of others. And this really kind of makes sense, particularly if the traumatic event was interpersonal in nature. If you think about it, if as a child, there's some type of interpersonal maltreatment, so this is physical abuse, sexual abuse, emotional abuse, if that happens to you when you're younger, it can really change the way that you view relationships. So it's kind of trust versus mistrust. And now maybe you start to view relationships as sources of pain. Maybe they're sources of fear or anxiety. So to me, if you start to change your view of relationships from trust to mistrust, you're probably not going to be as interested in developing relationships with other people because you feel like if you're in a relationship with other people, you have a higher risk of physical or emotional harm. So it makes sense that there's some suspiciousness or mistrust of relationships if there's interpersonal, potentially traumatic events that have occurred. Sometimes there can be continued expectations of violence or maltreatment continuing to happen to adolescents, or this is what a normal relationship looks like, that they expect violence is a normal aspect of what interpersonal relationships should be like. And because of that, sometimes they may repeat what they've experienced or witnessed because that's just the norm. This is what relationships look like. There's arguing, there's fighting, there's hitting, there's threatening, there's put downs. So they may find themselves unintentionally in these types of relationships. Sometimes there's perspective taking that it's difficult or enlisting others to be supportive allies because maybe there's a lack of empathy or they're having difficulty identifying and understanding emotions in themselves and in other people. And sometimes it's like, well, I want to have connections with other people, but because of trauma, they may try to reach out to form connections, but they're also mistrustful and distrustful and they're anxious about these relationships. They're maybe not able to do it very successfully. So even if you want to have those relationships, they may not necessarily have the best skills to be able to enact those social overtures to make relationships. Also, difficulties establishing appropriate social boundaries. Once again, because maybe violence is viewed as a typical part of relationships, they may seek out partners that may be violent or aggressive towards them, or once again, or find themselves in these relationships and not know how to separate from those relationships or get out of those relationships. Those that have experienced trauma, we'll talk about this in a little bit, have a higher risk of engaging in early sexual activity in multiple sexual partners as well. And sometimes they form what we call more deviant peer groups. So these are maybe other adolescents that are having maybe some behavioral difficulties, or there's some loners, or they're being rejected by their peers, and they form a deviant peer group, which is bad because peers, they model negative behavior, they reinforce it as well. So we really want to have these kids, if they've experienced trauma and are kind of isolated, we want to try to connect them with others in more of a kind of a pro-social peer group. Okay, we know changes with emotion and behaviors also happen in adolescence. So adolescents are getting better Not great because we know the brain isn't fully developed, particularly the prefrontal lobe, until like mid-20s. So they're getting better at stopping and thinking before acting, reducing impulse, and kind of waiting despite lack of immediate payoff. They're getting better. Not terrific or amazing. There's many adults that aren't very good at this either, but they're getting better with this. But here, once again, better impulse control, a better to think about delaying gratification, thinking through consequences. So this is happening, which is a good thing. But trauma impacts us. Once again, it's kind of the theme of the presentation of the webinar today. So youth who've experienced significant or long-standing trauma may have difficulty making realistic appraisals of danger and also governing behavior to meet kind of long-term goals. So sometimes adolescents have experienced trauma because they have altered perception of risk. They may fail to protect themselves when they're in dangerous situations, or they may not view anything as dangerous and they just go out and do things. In some respects, that's not a bad thing. It's good to every once in a while take risks. That's a good thing because if you only stay in your comfort zone, are you ever going to really grow and develop as much as you could? Are you going to ever reach your potential if you always make this safe choice? However, if you have altered perceptions of risk, though, you may think that nothing is dangerous. So now we have thrill seeking and we're just doing these risky things because nothing seems dangerous. That can happen. However, the opposite can happen as well. Sometimes people, when they've experienced trauma, they then start to see everything in the world is dangerous and unsafe, and I'm never going to do anything that puts myself at risk. That can definitely happen as well. So because of that, they avoid all risk. And like I said, that makes it difficult to grow and become independent as well. So once again, trauma can really alter people's perception of risk, either putting them more likely to experience trauma in a dangerous situation or always living in their bubble, always staying in their comfort zone and never taking risks that sometimes maybe should happen. So I'm going to dive in a little bit deeper into, so what are different types of risky behaviors that we see in adolescents and how common is it? Okay. So we have a study here looking at those who have had child sexual abuse, but this is looking at adolescent populations. And this is looking at the lifetime prevalence for boys and girls who this is the likelihood of experiencing having a PTSD diagnosis, also those who are having a substance abuse disorder diagnosis, and those engaging in various types of delinquency. And you can see here for boys, 28% of those who have experienced sexual abuse have a diagnosis of PTSD, 34% have a substance use disorder, 47% had some type of delinquency. And you can see for females, it was 30, 28%, and then 17%. But when looking at this was a study done way back in the 90s. And once again, these were teens who've experienced sexual abuse when they were in a child. There's a 4 to 5 increased risk for PTSD compared to their counterparts that did not have sexual abuse, 4 to 5 increase for substance abuse disorder compared to those who did not have sexual abuse, and then 3 to 5 times the rate of engaging in some type of juvenile delinquency, once again compared to those who did not have sexual abuse when they were in their childhood years. So anywhere from 3 to 5 to 4 to 5 increase for these types of diagnoses or risky behaviors if there was a confirmed sexual abuse that occurred in the childhood years. So that's for sexual abuse. They also looked at for those who engaged, had some type of physical assault that happened to them in their lifetime. And once again, we can see here for PTSD, substance abuse disorder, and delinquency, once again, the overall theme is about 3 to 5 times the risk. So 3 to 5 times greater the risk for PTSD, substance abuse disorder, and engaging in delinquency for male and female adolescents if there was some type of physical assault in their childhood years. This is looking specifically at physical abuse. And once again, it's about 3 to 5 times the risk for both boys and girls in the adolescent years. So you can see, let's just pick out for adolescent boys, 45% of them engaged in some type of juvenile delinquency as an adolescent if they had physical abuse in childhood. 45%, almost half of those who've experienced physical abuse in childhood have some type of delinquency in their adolescent years. And for females, it's 20%. So you can see once again, physical abuse, physical assault, sexual abuse in childhood puts these adolescents at a huge risk, 3 to 5 times the risk of experiencing these types of clinical presentations. And then this is looking specifically at those who have witnessed some type of violence, whether this was domestic violence or community violence. And for girls who witness violence in childhood, 17% engaged in delinquency. But not on the slide here is it was only 1.4% of adolescent girls who did not witness violence in childhood engaged in juvenile delinquency. 17% if you did witness violence, 1.4 if you did not witness violence for juvenile delinquency for females. That's 12 times the risk. So I'm just going to repeat that again. 12 times the risk for adolescent females to engage in juvenile delinquency if there was some type of witnessing domestic violence or community violence. That's huge, 12 times. That's an unbelievable statistic. So once again, these slides I hope are really demonstrating to you that these risky behaviors are occurring because of the traumatic events that are happening in childhood. So those statistics are a little bit older. This study looked a little bit more recently in the 2000s. This was looking at the past 6 to 12 months, also versus the lifetime. And this looked at PTSD diagnoses, MDE is major depressive disorder, delinquency, drinking towards intoxication, and a non-experimental drug use. And you can see these numbers here for males and females who have, once again, this is sexual abuse. So you can see high rates of all of these different diagnoses and clinical presentations in the adolescent years, and these, once again, in the 2000s for those who experienced sexual abuse when they were younger. So once again, causing a whole host of difficulties and problems. Okay, let's look a little bit more with different types of drug use as well. This is looking at marijuana, cocaine, non-prescription drug use, other drugs, and then also multiple drugs or polydrug use. And this was done in the 2000s, and this was with adolescents. And this is looking for those who've had potentially traumatic events before the age of 11. So once again, before the age of 11, looking at did they have higher rates of these drug use. So the red is 1 potentially traumatic event, the green is 2, and the purple is 3 or more. So for those who had 3 or more potentially traumatic events before the age of 11, it was about 2 to 2.5 times the risk than for those who did not have any potentially traumatic event for these different types of substances. And this is adjusted for age of the child, sex of the child, their ethnicity, parental income, and also the parents' own substance abuse problem as well. Because those are all what we call kind of confounding variables. These are things that could impact the outcome, but they controlled for those in their statistical analyses. So once again, for those that had 3 or more potentially traumatic events before the age of 11, had 2 to 2.5 times the risk kind of across these different types of drug use categories. Okay, let's look a little bit more at sexual behaviors. These are for boys and girls who have childhood sexual abuse. So for girls who've had childhood sexual abuse, once they're in adolescence, once again, without a history of childhood sexual abuse, about 2.2 times more likely to become pregnant as a teenager, and 2.5 times more likely to have 3 or more sexual partners. With adolescent boys with confirmed sexual abuse, they are 1.91 times more likely to have unprotected sexual intercourse. They are almost 3 times more likely to have multiple sexual partners and almost 5 times more likely to have pregnancy involvement. So you can see for males and females with confirmed sexual abuse compared to their adolescents without confirmed sexual abuse in childhood have much higher rates of partners, unprotected sex, being involved in pregnancy, and then and being involved in pregnancy, whether you're male or female. So once again, we can see kind of risky sexual behaviors occurring in the teen population when trauma has occurred to them. Okay. So those are some of the behavioral manifestations and the risky behaviors that we see. Let's talk a little bit about emotion development as well. So this is what we expect to happen. These are the things that often can happen when trauma occurs in this age range. Extreme difficulties controlling emotions. So adolescents, they're getting better with emotion dysregulation, but because of trauma, it makes it much more difficult for them. Sometimes there's even difficulties identifying emotions. It's I was sometimes amazed or surprised in my trauma work with adolescents of how many of them have a hard time identifying or just even listing emotions. You may say, just tell me different emotions. Often what I get are kind of happy, sad, maybe worried, angry, and that's kind of about it. To me, it's more similar to when you have a box of crayons, and the smallest box of crayons has like 6 or 8 colors in it, and that is it. It has very limited colors. It's the primary colors: red, blue, green, yellow, um, maybe there's orange, something like that, but very limited color. And it's the same thing with adolescents when they've experienced a lot of trauma. They have a very limited emotional vocabulary. So a lot of times the goal in treatment, and I'm sure what you all are doing when working with these adolescents, is trying to increase their emotional vocabulary so they can then start talking about emotional states such as embarrassed, ashamed, contempt. It's kind of these blend of emotions, bewildered. Like, so to me, it's the idea if you're trying to increase the box of crayons from like 6 or 8 colors to 164 colors. I know when I was a child, oh my gosh, I wanted that box of crayons every year for the back to school shopping. The box of crayons that had 164 colors. I'm sure you all remember that box of crayons. It was the most desired box of Crayola crayons imaginable. I always wanted the box of 164 colors. I maybe got it every once in a while, but most years my parents are like 16 or 32 is fine. Because that's what it said on the school list. So the idea is we want to move from the box of crayons has like 8 to 164 and increase their emotional vocabulary. So they just have a better understanding of identifying and understanding emotions in themselves and in other people. When teens, though, when they experience trust, sometimes, trauma, have difficulty communicating their wishes or desires. They're at risk of like depression or a decreased mood. And also, as we've seen in previous slides as well, increased risk for post-traumatic stress disorder or PTSD. Okay, typical cognitive development adolescence. In childhood, it's more kind of this concrete, really literal thinking. It's very black and white. It's you need concrete examples. There's absolutes. There's not a lot of critical reasoning or reflective thinking or thinking about the different possibilities. That's in childhood. But by the time you get to adolescence, they have a growth in their cognitive development. They can now understand abstraction, hypothetical situations, kind of the, well, what if this, what if this, what if this, and kind of the shades of gray. It's not just black, it's not just white, it's all of the shades of gray in between. And also, so often the answer is, well, I don't know, it kind of just depends on a myriad of different factors. So there's this greater capacity for abstract thought. They can take in a great deal of new information, retain it, and then apply it in a really strategical manner so that they can achieve well academically and kind of pursue long-term goals. So we see this growing more in adolescence. Once again, they're not perfect with this. Sometimes there's black and white thinking. They're really concrete, but they're getting better at this, more towards so hopefully what we see in adulthood. But once again, like I said many times, trauma impacts this area of development as well. So there's these higher level of cognitive skills called executive functioning. These are more about self-regulation, planning, problem solving, working memory, meaning the ability to encode information in memory, hold it, and then mentally manipulate it and use it for some type of purpose at a little bit later time. These are these executive functioning skills that many times are impaired in adolescence. Maybe for memory impairment, it's hard to follow 3-step directions. Go upstairs, brush your teeth, take a shower, change your clothes, and I'll be upstairs in a minute to talk about your day. That can be really hard for some adolescents because of these memory impairments and working memory issues because of the disruptions to executive function. It's hard to remember to do each of these different steps. Also, trauma reminders can be really impairing to cognition. It can get in the way of focusing or thinking clearly. If you're in algebra class and you're trying to solve these different equations, and then suddenly there's like a flashback, maybe you hear a loud noise and suddenly that was a flashback, or the tone of someone's voice, or a word that they say, or someone maybe touches their arm and it maybe was a little bit of a harder manner, maybe is a trauma reminder. They're instantly back at the place where their trauma has begun. There's a flashback, these intrusive thoughts, that's going to get in the way of you thinking or focusing clearly. Also, hyperarousal, you're feeling keyed up on edge. You're not going to be able to think or focus or think clearly or focus if you're just always on edge and you're thinking about something else. So that can be really hard. We know youth who've experienced trauma also have lower intellectual functioning scores on an IQ test, up to 8 points. And just to let you know, 8 points is actually a pretty big difference. I know a lot of you may not be psychologists and do intellectual functioning testing, but that's a pretty big difference. Children and adolescents who've experienced trauma aren't intrinsically less smart. It's just that trauma has gotten in the way of them being able to grow and have the same experiences cognitively as their counterparts who did not experience trauma. And also, but when you're experiencing trauma, so much of your cognitive resources are being diverted away from attention and learning because it's being more diverted to survival. If it's a Friday afternoon and you're supposed to be listening to a history lecture, but you knew when you go home, you have a caregiver there who maybe has a substance use problem and maybe is engaging in some type of physically or emotionally abusive behavior, you're maybe going to dread wanting to go home for the weekend. Or maybe there's food insecurity. I've already had my last meal. I'm not going to have any food for this weekend. You're going to be thinking about that. You're going to be thinking about surviving. You're not going to be thinking about listening to who was president in 1845, something like that. So much cognitive resources is being diverted to whatever the trauma is in survival. It really puts it in a much difficult place to focus and to think. And also 70% of youth in juvenile justice settings, so juvenile detention, have a diagnosable learning disability. So these are kids that have engaged in some type of illicit or illegal, some type of behavior and now are in some type of correctional facility, but so much of them also have learning problems because of the trauma that has occurred to them. And so much also is kind of difficulty focusing, paying attention. Some people may think, well, this sounds more like ADHD or attention deficit hyperactivity disorder. So a differential diagnosis is really important with adolescents experiencing trauma. You can have both. Having ADHD does put kids actually at risk of experiencing trauma. So just because some people swing too far to the all attention and difficulty focusing is only due to trauma, well, many times it's also due to ADHD, and someone may have both, or maybe ADHD, or maybe trauma, or maybe both. So it's good to be thoughtful about you can have two existing conditions at the same time. It's not only one or the other. But we know difficulty focusing, attention, concentration, impaired executive functioning all happens. Okay. And then identity development and future orientation. Wow, identity development, such an important part of adolescence. As I was preparing this webinar, I was thinking a lot about my own adolescence, which is kind of fun sometimes, but sometimes like not so fun because there's some hard parts in there as well. But just the identity, thinking about who am I? Am I more similar to my family? Am I more similar to my peers? Where do I get my sense of identity? What are things that are contributing to that? Am I more similar to my family with maybe like different values or beliefs with religiosity or political affiliation? Am I more different though when it comes to tastes in music or television show? But just this identity development, so often we're putting on these different hats. Who am I now when I'm like this? What if I'm like this or like this? What clique or group do I fit in with? Like, just who am I? So they begin to recognize uniqueness a lot more and really to begin to identify themselves as being separate or different from one's own kind of background that they um, grew up in. Once again, am I similar to my family of origin or am I different than? There's an opportunity to kind of redefine their identity as we move through the adolescent years as well. But that's where mentors and role models become really important as well, because these adults that they have in their life, if maybe they don't have the close connection with a family member, do they have a close connection with a neighbor, a grandparent, a religious figure? It could be a coach. It can be a teacher. Any of those people can be really important providing this mentorship. So they begin to think more about, once again, their identity, but just their future. Where do they want to go to college? What kind of career do they want to have? It's interesting. So many of my my adolescents, or my adolescents, excuse me, my nieces and nephews are adolescents slash teenagers. And it's interesting asking them, it's like, what do you want to be when you grow up? And just kind of hearing their changes from, I want to be a baseball player to, Mom, now my nephew who wanted to be a baseball player now is in college and is majoring in computer engineering. And I was like, okay, yes, you have a very different career being a computer engineer than being an MLB professional baseball player. But it's interesting just to hear how people's thoughts as they move throughout adolescence, from early adolescence to later adolescence, what do they want to do for their career? Um, where do they want to live? Their kids, do they want to be married? Where do they want to live in the same location? Do they want to move somewhere else? So it's just really interesting as they begin to plan for their future. But adolescent identity, it's often an extension of one's own family or parents, like I was mentioning. So if they've endured trauma from their family or their caregivers, it can be really difficult because their identity often is an extension of them. But those were the people that were the perpetrators of the trauma for this adolescent. Wow, that can be really difficult and can be really hard to process and think through as well. Um, so just so much happening with identity development, but trauma definitely gets in the way here as well. So much time, as like I was mentioning in the previous slide, is thought about expending energy in the moment to survive. You're focusing on safety, in protection. You're just trying to get through the day. You're trying to survive the weekend. It's just so hard sometimes to think about, I don't think I have a future. I'm not going to have a good future. It feels so hopeless and you feel so helpless in your situation. It just may lead to a sense of foreshortened future, and it really can interfere with future planning. Like, I'm not going to be able to have the life I want. I'm not going to be able to have the career. I feel so ill-equipped to just manage what's happening in my own life. How am I ever going to get married and have children? How am I supposed to manage or support having a partner? Or how am I going to raise a child? I don't know what it's like to be a parent. I maybe had a terrible childhood. How do I know what I'm supposed to do? So this sense of a force-shortened future, this lack of identity, uncertain of what's going to happen. I don't even know how I'm going to function as an adult. All of those things may be happening because of the trauma that they've experienced. So I've just reviewed a lot about how trauma impacts their physical development, social development, behavioral development, emotional development, cognitive, and kind of the identity and future as well. So it feels kind of like a bummer. It kind of feels like, wow, Glenn, this is not a very uplifting or happy webinar. In some respects, it's not. I think all of you who have worked with teenagers